Support for your public radio station comes from our members and from Excellus Blue Cross Blue Shield, believing that everyone deserves to be cared for and to live well. Through community investments, partnerships, and education, Excellus Blue Cross Blue Shield is working to address health inequities. More at excellusbcbs.com.
From WXXI News, this is Connections. I'm Evan Dawson. Our connection this hour was made on a Little League field with an unexpected discovery. I want to quote directly from the prologue of a new book about homelessness from Josephine Ensign. And she asked the reader this question. Suppose you are the coach for your son's Little League team, and you arrive for a Saturday game at your local city's park baseball field to find a man camped out in the dugout. What would you do? Would you offer to buy him pizza and help move his tent and belongings off the field so the children can play? If he refuses to leave, would you call the police or your elected officials or the people at Parks and Recreation from whom you reserved and rented the field? Is there a more compassionate and skilled team of outreach workers that you could call? Would they even respond? Generally speaking, what can we do about those people who don't seem to want any help? Why do we allow people to live in tent encampments in our parks and on our sidewalks? What is causing such an increase in homelessness? And what are some possible solutions? End quote. For Josephine Ensign, this scenario poses a number of important questions for our society. How do we view people who are experiencing homelessness? Is our first instinct to call the police? Is it to turn the other way? Is it to scoff or sneer? Ensign has spent her career working on these issues, and she comes from a place of personal experience. She was herself homeless in her early adulthood after a tumultuous marriage and in a setting that caused all kinds of trauma. For decades now, she has worked as a nurse, as an advocate, as an author, a podcaster, asking society to make sure all of its members are seen and heard. Her podcast series introduces us to both policymakers and to individuals who've experienced homelessness and who can talk about what worked and what did not. Ensign is in Rochester as a guest of SUNY Brockport for an event tonight. They would love to see you there. But first, she is our guest here on Connections. Josephine Ensign is a professor of nursing at the University of Washington School of Nursing and the author of multiple books, including Way Home, Journeys Through Homelessness. Welcome. Thank you for making time for us today.
Thank you for having me.
Well, I think our listeners are wondering, what would you do if you found a man sleeping in the dugout on game day?
Yeah, so that scenario is an actual question that one of my nursing students asked me one time. And I've also seen it in action, right,
Sure, yeah.
with my grandchildren, et cetera, in Seattle parks. And so, I mean, obviously I have insider information on probably what the most effective way would be to handle the situation. Hopefully not the police, unless there's violence or something else, or need to call somebody in terms of health crisis. And hopefully then I would know like who outreach workers are in that area, who I could call to try, if not right then to intervene, but then to follow up with a person.
Yeah, I mean, in the book, you asked the question, are there outreach workers who you could even call and would they respond? That may be true. I know that's true in Rochester. We've talked to many on this program over the years, and I can name them off. You can probably do that in your native Seattle. That's not true everywhere. But set that aside for a moment and just tell me what the human response you think ought to be.
That's a good question. So the human response is, I mean, obviously I'm going to be frustrated, right? Because here I am, the Little League person, and I'm trying to be a good team leader and get the field ready. But I would hope that I would pause, like internally, take a deep breath, and realize that this is a person, and that they're trying to survive the best they can, even though this is not where you would want somebody to be camping out. You wouldn't want to be camping out there yourself if you were homeless. So to try to meet that person as a person, greet them, try not to, start getting angry because that's not going to help anybody. And ask them, what you could do to help, and just point out to them that you need that space as well for little kids. So how could you work it out together?
Do you think most people or many people would call the police?
Yes.
And then what happens?
Well, if the police respond in Seattle, that's most likely not the case. I mean, we we definitely have had a lot of Seattle police reform, really good police officers, but unless it's violent, like there's something really imminent, they probably are not going to be able to respond. So that's not the best use, and it also is not the best outcome for that person, in terms of being dealt with.
So before we kind of get into some ideas about what works and what does not, and what your experience has yielded in your professional career, can you let our audience know a little bit more about your own experience with homelessness?
Yeah, so that, I always try to point out to people that everybody's experience is different. I mean, there's no one experience. So mine was when I was a young adult, and I was living in my hometown then of Richmond, Virginia, and it was in the 1980s. So for me, it was like my marriage breaking down, also challenges from my work, from my bosses who were extremely religious right, and I was questioning kind of that approach to taking care of the people in the homeless shelter where I worked, and then spiraling into depression related to, at that point, childhood traumas that I was only in my 20s, right? I was still young, had not really addressed adequately. So it was complex. I was fortunate that it didn't last for long. I was not, literally on the streets or in emergency shelters. I was living in my car, and I work with a lot of vehicle residents. I know you also have a lot of people living in their vehicles or RVs, as well as families here. And I did know how to get help, to be able to work on that and then get out of homelessness.
Your point, I think, is well taken, that every individual's experience is different. And you've never, that I've seen in your writing or your podcasting, tried to hold out your own experience as some sort of model or an all-encompassing view of homelessness. I do want to ask you, how has that informed the work? How has that helped you at least understand the issue better?
Yes, and that's, people with lived experience of homelessness, that there are cases, and I could have fallen into this, where then I would be like, oh, I got myself out of homelessness. Why can't you? The whole judgmentalism. And that's why I also wrote my first book, Catching Homelessness, which is really a medical memoir of that time, of how it has deepened and also made more complex my understanding of the nuances of what goes into, both structurally contributing to homelessness in our country, as well as individual vulnerabilities, and then what it takes to be able to work out of that.
What is the most consistent judgment that people who have never experienced homelessness have that is incorrect about homelessness?
That it's all their fault, that they're all mentally ill, that they're all on drugs, they're all lazy. Those whole thing that we've had forever in our country about people who are poor, that they brought it on themselves.
And so there's this tension, I think, and I want to explore a little bit of this with you. You live in Seattle. You've worked in Seattle for decades. Seattle's got the third highest percentage of homelessness in the country, behind Los Angeles and New York. These are sort of classically politically blue cities, right, in classically politically blue states. Before we talk about that, there's a term that's interesting. And for listeners who hear it, Sometimes you'll hear Josephine say houselessness. You'll hear advocates say that. And you explained in a recent talk that I was watching that this isn't just like a squishy term to kind of placate people. There's a reason that activists use that term because they view the lack of housing as a primary driver. So they use the term houselessness as a way of highlighting the fact that we don't have the supply to deal with this problem, and we've got to put a spotlight on that. Do you want to talk a little bit about that?
Yes. And that is like research that's been done about what are the contributing kind of systemic contributors to homelessness, and looking at that in terms of especially the West Coast, of why such high rates of homelessness. And it really boils down to a lack of affordable, safe, affordable housing, permanent housing that people can stay in. It's not because of increased permissiveness, drug use, or mental health disorders or anything like that. They are all, I mean, I am biased this way, right? But they are desirable cities to live in, right? And probably at least partly because of their politics. So people are drawn there as well. But the vast majority of people who even experience homelessness in Seattle, they're from the Seattle area or from Washington State. You know, they don't move there to become homeless. And so I think that calling out and trying to emphasize houselessness is important at the same time of recognizing, again, both from my personal experience and also working with people over decades experiencing different kinds of homelessness, that it's not only about not having a safe, affordable place to live. It's also about all of the breakdowns in social networks and how we treat people as a society, all of the different kind of social exclusions that happen that make it so much more difficult for people to work their way out of homelessness.
I'd like to listen to a couple of clips and get your take on this. So there's been a lot of talk in the discourse lately about a new book from a couple of public intellectuals who are on the political left, Ezra Klein and Derek Thompson. Their new book is called Abundance. The entire first section of the book is on housing. And in a recent podcast on Derek Thompson's Plain English, I want to listen first to Ezra Klein talking about his experience of moving back in his adulthood to his native California and what he experienced.
I went back to California. And the state, in my view, just was not doing well. And when I looked around at why it wasn't doing well, why it had become so unaffordable, why it had such a bad homelessness problem, why people were so upset, why so many people were leaving, right? California was and is losing people. It was really just clear we hadn't built enough. The things we had wanted to build, like high-speed rail, had not come to fruition. We did not have enough mass transit. There's no functional, I shouldn't say functional. There is no good subway system in Los Angeles. It would be such an amazing city if it had a good mass transit system. But we weren't building enough homes. We weren't building enough clean energy to meet our clean energy goals. That California's problem was not its commitment to justice, but its commitment to expanding supply.
And then he talks about, in this second clip, he talks about what that means for the working class, what it means for people who want to be able to live in Seattle or Los Angeles or New York City, and how that has changed. Let's listen.
Working class people are leaving the high productivity areas to move to low productivity or lower productivity areas because it's just too expensive to live there. You know, there's Ganong and Shoa, whose work I quoted in the book. You know, they have this sort of thing about like the janitor and the lawyer. And it used to make sense for a janitor to move to New York City, and it made sense for a lawyer to move to New York City. Both of them would make more money there. Now it still makes sense for the lawyer to move to New York City, but not the janitor, because the janitor can't afford a house, can't afford a place to live. So in gating the megacities by constraining the supply of housing such that they became inaffordable to live in, what we've done, in addition to making them inaffordable, is shut off a driver of opportunity.
So that's Ezra Klein talking to Derek Thompson. What do you make of some of what you heard there?
Yes, I have many thoughts on that. Again, the city that I know the best outside of Richmond, Virginia, my childhood home is Seattle. So I completely relate to Ezra's observations about the infrastructure. Seattle has, we do have a light rail system. Some of it is underground. It is always breaking down. I couldn't even take it to get to the airport yesterday. And I was reflecting on that, like going through Dulles. They still have the people movers. I love the people movers that are still, they've been there since, I don't know, it started. Why can't we build something that works, just infrastructure-wise? And Seattle right now is going through, and Washington State has just enacted laws to change single-family zoning. That has, Seattle, I guess it still is the case. We have the largest single-family zoning of any major city. And so, of course, it's going to be on, people can't afford places to live. And so that's changing, going to more multifamily and, apartments and condos. But still of trying to make sure that there are enough that are affordable, that aren't market rate, through the roof for people to have to afford. So I agree with that something has not kept pace with, I think, more idealistic notions of justice and anti-poverty, more equity, that for some reason we haven't kept up with that, of what we actually need infrastructure-wise, with housing, with transportation, with public education, all of that.
Well, I don't want to oversimplify Thompson and Klein's critique, but in some ways it sounds like this. The progressive enclaves in this country, of which Seattle is certainly one of them, is filled with people who feel good about driving a Prius for years, or driving an EV and voting a certain way. But they are largely populated by NIMBYs who also oppose multifamily housing, lower income housing, support for homeless services. So they feel good about themselves for being on the right side of the politics, but they don't actually act in ways that help people in the most dire circumstances. That's an overly simplified analysis of some of where abundance is as a book, but is there a grain of truth to that?
Yes, I think so. That accelerated by the pandemic, Seattle has widening income disparities. And anytime you have that, even if you have, no matter what the ideology is of people who are on the upper end of that spectrum, it's a lot more difficult for someone who's climbing that socioeconomic ladder to maintain any kind of empathy for people who don't have what you have, and to start distancing yourself from them, gated communities, or going out to suburban sprawl and things like that, where you're not having to, on a daily basis, confront poverty and homelessness as much. It looks different in those areas. And
I would encourage listeners to listen to Klein's recent conversation with Zephyr Teachout this week. I think, where is she? A Fordham law professor who ran for governor of New York State. We're working on finding a date for Zephyr Teachout to come on this program. Her critique of Klein and Thompson's critique is that they're missing the culprits. She still blames largely the billionaire class, income disparity, the powerful who are sort of entrenching their turf. But I don't think it changes the fact that if you look at the issue of homelessness, it is more acute in bluer cities and states. And so the question then becomes, what do you do about that? So, you've had a lot of time to think about policy. You've heard from almost all the policymakers, and you've talked to people who are experiencing different ideas for what would work on homelessness. Let's talk a little bit about, I'm going to give you the keys to the castle of Seattle, at least, or whatever. Pick any American metropolitan area. What are you going to do first when it comes to homelessness?
Well, and I think also, especially as a nurse, right?
Yeah, sure.
Love nurses, love nursing, that's why I am one, is we have to take care of immediate needs, immediate suffering. Yes, we also need to be working on upstream policy solutions, like changing zoning laws and all of that. But until that can become a reality, or work on like infrastructure and public transportation that actually works. We have to take care of the people that are suffering in our doorways, on our streets, parked on our streets in their vehicles, and provide services that at least lessen that suffering and work with them again as people. What would help you? Where would you really prefer to be living? And what can we do to facilitate that happening for you? Giving people agency, as much agency as they can handle at that point. And also more programs that are not judgmental, that have a harm reduction approach to them. I mean, so many of our emergency shelters, et cetera, traditionally and even still do, you can't be under the influence of anything to come in here. And if they're not being dangerous to anybody, why are we doing that? That's judgmental. Getting them into a place to live. We know that getting someone into permanent supportive housing, it can really help to reduce their rates of alcohol, drug use, get them mental health, improve their mental health, even if they're not taking medications. And so, supporting more of those. There's a big backlash in our country against those now.
So let me take policy point by point. And I want to start with harm reduction. You mentioned harm reduction. We had Rob Kent on the program earlier this week. He is a former Biden White House. He was a legal counsel on drug policy. He helped write drug policy for the Biden White House. And he described what it was like working with President Biden to try to convince him to use the words harm reduction in the State of the Union. And he said Biden finally does it. And the team that's working with Biden was almost amazed that to hear a president say that in that setting, because it has been kind of controversial, and there has been kind of a push and pull and an ebb and flow on the idea of harm reduction. There's certainly, I don't want to make it just a left and right or progressive conservative, but I think there's a somewhat conservative pushback that says harm reduction is too permissive or too encouraging of behaviors that lead to long-term problems, and there needs to be more of a tough love approach. So I want you to define harm reduction first of all, and then tell me what you think the evidence says about that.
Yes, I'd love to. So harm reduction, kind of simplistically, is reducing the harm to that person and to people that they're in contact with, and the wider community, while helping them to move towards what it is that they want to work on. So it's not like anything goes. You can just keep using sort of a thing, although some people on the continuum of harm reduction have that, but okay, you're still using meth, using what we call motivational interviewing. What are the consequences of that for you? What matters to you that you would like to have less of, or have more of that's positive and less of that's negative? And how can we help us individually, healthcare providers, community, to help you to do that? We have some really amazing harm reduction programs in Seattle. I mean, Needle Exchange is one I know that's controversial. It saves lives. I came of age as a new nurse in the beginning of the HIV/AIDS epidemic. I had many patients that died, and knowing that use of condoms, getting safer sex information out there, getting where people could more safely inject, not reusing needles or sharing them, that it saves lives and helps to decrease a big burden on society as well. We now have, because we have a big problem with fentanyl and meth, as a lot of places. And so we have not just Narcan in lots of places, but we also have contingency management kinds of programs where people, like even the women's shelter where I work, they can sign up to start doing, dropping off a urine. And if there's reduction in use, they get positive rewards, which helps with our dopamine, right? And can help them to at least reduce use of things. And we have lots of other harm reduction programs as well.
I remember reading Sam Harris's book called The End of Faith back when it came out in 2004, and he looked at programs that were working in sub-Saharan Africa on disease outbreak. And he looked at two different organizations, one secular and one very religious in its ministry. And they were doing almost everything the same, except for the secular group was passing out condoms and the very religious group was taking them away, telling
Well, that's pretty gross.
telling people that,
You
that
shouldn't use
premarital
them.
sex is not in God's image and that you shouldn't be having sex at all. And that made me think this last week about Pope Francis, who we talked about yesterday, who has talked in his life, in his papacy, about meeting people where they were, not in the cliche sense, but understanding what is a realistic set of demands on what human beings can do and not do. And if you are so rigid in what you demand of people, you're going to shut doors on those who maybe are not meeting your standard, but certainly need some help. At the same time, what do you say to that, the more conservative critique that says, a lot of harm reduction, needle exchanges, supervised use, leads to an exacerbation of the problem, or at least a continuation of a problem instead of an attempt to end a problem?
Right. Well, and there are certainly cases where that can happen if they're not, from my perspective, if they're not run well. Because I think that having more palatable options for at least reducing use or quitting altogether, having more sober housing available as permanent supportive housing is also hugely important. That's really important for, I've worked with prisoners in Washington state prisons. And, the criminalization of poverty, how they were homeless before they went to prison, and they're facing that again, but they've gotten clean and sober in prison. They want to return to sober living. And we don't have enough options for people with that. So I think of, again, just recognizing the reality. There are lots of people who use and abuse alcohol and other kinds of substances who live in places where we don't see that, right? And so why are we taking out our judgmentalism on people who are doing that, but having to do it more visibly on our streets?
And to be clear, I want to mention, as Josephine said earlier this hour, and in her books and work, not all people who experience homelessness are struggling with drugs and addiction. I mean, that's one of the stereotypes. It certainly can be a very big challenge. It is not everybody. Having said that, how do you feel about supervised use sites?
So, been to the one in Vancouver, British Columbia.
Yeah, more famously, just because there haven't been all that many.
It's been illegal in our country.
Vancouver is one of the first that I had even heard of. Is it still operating?
It is. It's gone through some changes. It has started to incorporate much more robust, even on-site treatment options and better treatment options, buprenorphine, different things like that, than it did early on when we didn't have those treatment options, for instance. And there definitely are under the table supervised injection use places, like even in LA, places that I have worked with. Where it's not like an official site, but that is what's going on in a healthcare facility. And I think that having those as an option on the continuum of, for instance, prevention in the first place, early intervention and prevention before people get deeply entrenched in substance use. So many times it's functional use, like take, for instance, meth. Which is a really big problem in Seattle, not just among people experiencing homelessness, but general population. And that, it's a stimulant. If you're homeless and you're trying to survive out on the streets of Seattle at night, in the winter, or whatever it is, the elements, you're going to want to stay awake so that hopefully you don't get assaulted and have your things stolen. So that, a lot of times people start off with that as a functional use, to stay awake, to stay alive, and they don't realize how different meth is now from how it used to be, how strong. And then they get addicted. But you're right, not everybody who experiences homelessness is mentally ill.
Sure, yeah. And so in general, last question on harm reduction, as an umbrella of an approach, is harm reduction moving in a direction of getting more momentum, or is it facing more headwinds now, generally speaking, in this country? I know you work primarily in Seattle, but do you think harm reduction has a lot of sort of political and social capital right now, or is it viewed more negatively than it was 5-10 years ago?
Well, it depends on
And
which
where you
camp
are?
you're talking about, right?
Yeah.
I mean, it definitely has a lot of support and bipartisan support. For instance, in Seattle, and even in LA and San Francisco, places like that I've worked with, it has huge pushback among more conservative-leaning folks locally in those areas, including in Seattle, and then obviously with the current federal situation that's going on. So a lot of pushback from that, and pushback federally as well on permanent supportive housing, which is really unfortunate because that is evidence-based.
After we take our only break, I'll work in some of your feedback. We're talking to Josephine Ensign, whose newest book is called Way Home: Journeys Through Homelessness. She is in Rochester as a guest of SUNY Brockport, and you can go to hear her tonight at 7:30 p.m. at SUNY Brockport. It's happening at the McHugh Auditorium on the Fannie Barrier Williams building there, and it's part of their one of their Writers Forum events. In fact, it's the final event of their season, and they're glad to have Josephine Ensign here. You can listen to her podcast. It's called Skid Road. I've had a chance to listen to a number of episodes, and she interviews policymakers, people who work in homelessness, people who have experienced homelessness, and it's a very human. It's a very strange thing to say, but it's a very human way of talking about the issue of homelessness. So her podcast is called Skid Road, and she has other works and books as well. So we're talking to Josephine Ensign, and we'll get some of your feedback on the other side of this only break.
Support for your public radio station comes from our members and from GreenSpark Solar, serving the greater Rochester and Finger Lakes regions for over 20 years. GreenSpark Solar is dedicated to helping people power their homes and businesses with local solar power and battery storage backup. More at greensparksolar.com.
This is Connections. I'm Evan Dawson. So let me work through some feedback. Joseph wants to know about your feelings about UBI, Universal Basic Income. Joseph says, we saw a little bit during the pandemic. He says Canada did more than the United States. I don't have the data on that. But is that part of the set of solutions, you think, for homelessness?
I think so, at least some version of it. I always point out to people that we actually know what helps to reduce, if not end, homelessness. Veteran, the whole effort to end veteran homelessness until recently has had huge impact. And then in Washington State, we've had really amazing success that includes direct cash payments to young adults experiencing homelessness across our state or at risk of that, like during the pandemic. For instance, somebody in a rural part of Washington State who had to drive somewhere and their car broke down, they could get a direct cash payout, and it helped to reduce youth homelessness across our state by 40%. And, it obviously wasn't like, oh, here's $100, go party. It was, working with local social service agencies and schools and things like that. But I think it makes sense to have some form of that. Could definitely help.
Chad's got a couple of questions. He says, what is the politically conservative approach to reducing homelessness, especially for those who are incapable of working? I don't know. That is not Josephine's politics, I think, fair to say?
No, I can say that. We've had those solutions in the past, and it actually, unfortunately, has been talked about, again, by the current administration, and that is poor camps, poor farms. Of basically rounding people up who are homeless, destitute, and putting them in poor farms away from our cities, making them work to pay their way. So, basically a form of incarceration.
When you think about what President Trump has said about San Francisco, so San Francisco, I think, has had some very well-documented problems with homelessness in recent years. And yet, when big international events come, President Trump says, well, all the homeless people disappear. So they care about it when big international events come. What do you know about what's going on there?
Yes, I do know what's going on there. Well, until the current administration has put a dent on travel, people from other countries wanting to come to our country. The World Cup is coming to Seattle. The mayor's commission and planning for that, the infrastructure, and they're putting more money into outlying areas of King County outside of Seattle to basically bus all of the homeless people from Seattle. I'm simplifying this, but not really. But basically to ship them out of the city
To go where?
To some of the suburbs and some of the rural areas in King County outside of Seattle, at least temporarily. So that's been going on for a long time and is still going on. It's not that we solve homelessness that way.
It's that you put people on a bus for a couple days?
It's like having your mother-in-law come to town and you put a curtain over that messy storage shed that you have, right?
It's not actually solving the problem. Yeah.
All right.
Okay.
And it's making people who get shuffled out even more socially excluded and worsens self-esteem and getting them away from the services that they need.
Well, maybe related to that, Chad asks follow-up. He says, could you talk about the mindset that one gets set in from having to manage immediate needs, like not having enough food or clothing or shelter, for months or years on end? What is that like mentally for people who have to try to solve long-term problems like finding a job, finding housing, but in the short term, they literally don't have clean clothing or a place to stay or food for the day?
Right. Well, that's going back to Maslow's hierarchy of needs, right? Our immediate needs as humans are like safety, food, sleep, shelter. And so if people are having to put all of their time and energy into meeting those basic needs, they're not going to be able to have long-term planning or take care of health problems, get to appointments or think about things like that, much less self-actualization. But at the same time, I want to point out that so many people who I've worked with and still work with who are experiencing homelessness are extremely gifted in all sorts of different areas, writers, musicians, and poets, etc. And they somehow manage to keep some of those up. Like I have a pianist who is able to practice piano at the downtown library. So I'm not wanting to, again, make those stereotype generalizations. People are also working on these amazing creative pursuits. But yeah, it numbs people and it just gets overwhelming. They can't have the time and energy, headspace to work on other things.
Dallas emails to remind me that the San Francisco issue recently was when I think Xi Jinping and the Chinese delegation came to visit Governor Gavin Newsom. Mm-hmm. And all of a sudden, in Governor Gavin Newsom's, I think he used to be mayor of San Francisco.
Right.
All of a sudden, a lot of the issues on the street disappeared
Yes.
for a few days.
Yes.
Didn't solve any problems, but found buses for people to get on. And Dallas also says he thinks that the more that a city focuses on justice and equity, et cetera, the more expensive it becomes to live in that city. Do you think there's a connection there?
How could there be a connection between that? Sorry, I'm just trying to think of basic economics. Maybe I'm missing something with that. I'd have to think about it more. But I don't see that as being a direct link. I mean, how could DEI efforts displace people or make it more expensive to live in an area?
Yeah.
That one stumps me.
Okay. Well, I mean, Dallas, who leans politically conservative, I think, might also just be equating the fact that, as we talked about, the highest homelessness rates in this country are in three of the most politically blue cities: New York, LA, Seattle. And, you know, larger cities with Republican mayors and in red states don't have as high of an issue of homelessness. They certainly have it. And they don't have perfect housing situations, but housing is more affordable. And what Dallas is simply drawing a conclusion of is left-leaning politics are not working for people.
Right. I mean, that's a common thing. And again, research, including Greg Colburn, who I work with at the University of Washington, has done national research looking at that question. And it's not about the politics. It's not about, it's not about drug use. It's not about levels of mental illness. It's not about the weather. That's another thing that comes up of, the West Coast, it's got better weather. But it's really down to affordability of those areas.
I mean, how's Seattle's weather?
How's Seattle's weather compared? I mean,
compared to LA, it's not as good. Nobody's as good as
No,
LA.
that's true. We're getting much more extremes, just like everybody else is.
Yeah, point being that homelessness can happen
Anywhere.
in high rates anywhere.
Yeah.
Anywhere. And certainly here in Rochester continues to be a challenge. So back to the question of if you had the keys to the policy castle,
Yeah.
and you talked about the
Hey,
first...
I knew you would push me on that one.
Well, and so I mean, I appreciate the fact that as a nurse, your first instinct is to say the people who have immediate needs, we need to get to those folks, and we can do that. And then...
While working upstream.
While working upstream.
Yeah.
So is there something that isn't happening that you go, I can't believe we're not doing X, Y, and Z. I can't believe we're not doing more of X, Y, and Z for housing, for housing, for homelessness, for the issue in general?
Well, okay, back to Seattle.
Yeah.
Lots of services and different agencies, NGOs, nonprofits, and faith-based government agencies. And for a long time, everybody was kind of like working separately, and we didn't have a cohesive King County plan to address homelessness. We now do have that. It's gone through problems. It came into existence finally during the pandemic. It's gone through leadership changes. It's not perfect, but of trying to look at this from a government perspective of this is not just a Seattle problem. We also have suburban, rural homelessness, and that people and administrations in those areas need to step up and do their share, and to have some type of coming together and trying to plan and distribute funds more equitably. It's not perfect, but they are working on that. They also have a lived experience coalition. Not perfect, but at least they have people who have had experiences with homelessness who are part of at least contributing to the discussion.
You mentioned that yesterday you struggled to use public transportation just to get to the airport in one of the country's most progressive-leaning cities. And Klein and Thompson talk about the lack of good public transportation in L.A. How important is better transportation for dealing with the issue of homelessness? Is it related to jobs, access, opportunity?
Yeah, of course. And then, and also helping people get to healthcare facilities that they need to go to, or other kinds of things. So public transportation is hugely important. but I don't see. And again, I mean, and the pandemic has messed up lots of these types of things, because even in Seattle, statistics just came out that yes, people are starting to go back to the office. There's back to the office mandates now, even for Amazon, and instead of people taking public transportation, they're driving. So yeah, and singly, not actually doubling up or anything. So that's not helping the situation.
I read a brief piece recently, and I need to spend more time thinking about this before I feel like I know how I think about it. But the argument was that when the American interstate system, the highway system, was created, it was a choice that has haunted us, because it was a choice that prioritized the automobile in this country vis-a-vis Europe instead of investing in a massive coast-to-coast higher speed rail system, and that we have prioritized the automobile ever since. And it makes sense to me. I hadn't thought about it.
Well, and
in that
also Seattle's affected by this historically and even currently with I-5 going basically through downtown Seattle. And they chose the land where the most working class, the most people in poverty, where our nation's first racially integrated public housing, Yesler Terrace, was located. So that wasn't by accident, right? It's where they decided to build these, and how that disproportionately impacted people in poverty, and how it still is impacting the communities where those were put.
Before we go, you created Skid Road as a podcast, and I kind of clumsily described it as a very human set of conversations about some very, very difficult issues. So what would you describe as the mission of Skid Road, and what have you learned from doing your own podcast?
Yeah, well, it didn't start out as a podcast. I've done like 65 oral history interviews over the past 10 years, and a lot of that helped to inform the writing of both Skid Road, my Skid Road book, and then also more recently Way Home. And I had so many people asking me, well, can I listen to these? They're going to be archived at University of Washington, but I decided they needed to be out there in the world, and I had people's permission to share those. And so that's how I got into that of realizing that even the ones that are older, that are like 10 years old now, that those are really relevant. We had Charles Royer, three-term mayor for Seattle, very progressive, helped usher in healthcare for the homeless programs in the 80s, who recently died. And I have a really good interview with him. So of making those available, and also, again, of trying to privilege people with lived experience of homelessness who not only have survived homelessness but have gotten out, to hear from them what they think now, they know now, help them to survive and to get out and stay out of homelessness. I think those stories, those positive stories, are so important that we don't get to listen to enough.
We have just a couple minutes left. Is there a story or a moment in that series of interviews you've done that has stayed with you, that either changed your mind or moved you in a way that surprised you? Yeah,
so this is from Jen Adams, who is a woman who lived in her car, in her RV, for 17 years in Ballard, had been a working class neighborhood of Seattle. And she told me that what helped her the most was this volunteer, not faith-based, but volunteer outreach, non-judgmental, who would bring her hard-boiled eggs, because she has MS. She needed to eat a lot of protein. And she said hard-boiled eggs and hugs, because she got to know them. She trusted them. They gave her hugs, were what helped to make her feel like she was part of the community and that she could actually get through this and start giving back. She works with my students. She's in charge of a vehicle residency outreach program. Just an amazing woman.
Hard-boiled eggs.
And hugs.
And hugs. Yeah, that's easy to remember. Powerful. Tonight, The Brockport Writers Forum is welcoming Josephine Ensign, who has been my guest this hour. And Josephine's books include her most recent, Way Home, Journeys Through Homelessness. The event tonight at Brockport starts at 7:30 p.m. It's at the Fannie Barrier Williams Liberal Arts Building in McHugh Auditorium. Public is welcome. They would love to see you there. What are you planning on talking about tonight? An extension of what we talked about here?
Yes, I am focusing on my most recent book, but of bracketing it with poetry that I've also written, and just helping people to kind of think through what it could be like to experience homelessness if they haven't done that, and what we can do better as a society to help.
Last 20 seconds, having done this now for 4 decades plus, and experienced what you've experienced, do you find despair or hope, considering you're living in a city that's still number 3 in homelessness in the country after all this effort, all this attempted change?
I think because of the people I work with, like Jen, I'm concerned about our country, but I have hope.
Well, I want to thank you for making time for our listeners and our viewers today. I wish you well in the trip to Rochester. Hope you get public transportation home when you get back to the airport in Seattle. The newest book is Way Home, Journeys Through Homelessness. It is available now. The podcast is called Skid Road, and you can find Josephine's other works as well. Her website's very helpful, a lot of great stuff there. Thank you for making time for this program today.
Thank you for having me.
Josephine Ensign, tonight, 7:30 p.m. at Brockport with the Writers Forum. More Connections coming up in just a moment.
This program is a production of WXXI Public Radio. The views expressed do not necessarily represent those of this station, its staff, management, or underwriters. The broadcast is meant for the private use of our audience. Any rebroadcast or use in another medium without expressed written consent of WXXI is strictly prohibited. Connections with Evan Dawson is available as a podcast. Just click on the Connections link at WXXInews.org.
Support for your public radio station comes from our members and from Volunteers of America, hosting a screening and panel discussion of the documentary Americans with No Address, exploring the growing homelessness crisis and how communities are addressing it, April 30th at the Little Theater. More at voaupny.org.
Did you know you can name WXXI as a beneficiary on your insurance policy or retirement account? It's an investment in your community that will last for generations. For more information on naming WXXI as one of your beneficiaries, please call 585-258-0286 or visit WXXIlegacy.org.